Okay, you guys, welcome back. This is part 2 of 2 video series. Part 1, we did this exact same style brace with 2 adjusting dials for the Locking Hinged Knee DME. This is the Locking Hinged Elbow Brace. I'm going to show you a couple key components of it, and then we're going to go ahead and apply it to the patient. It only has one dial versus the medial and lateral dial of the knee. It works very, very similar as the knee one that if you've seen that video prior to this one. It has a lock that allows for the arm to stay in full extension, or if the doctor orders it in whatever position, let's say 0 to 90, and let's say the doctor wants to keep them in 90 because they are, for example, post-op elbow, you can lock it and you can keep them locked in a 90-degree angle. Or there are some repairs where they want them to remain in, like, let's say, for example, 40 or 45, and we lock it in that position, and that's how they stay, and so on and so forth. Then again, the adjustments vary depending on the doctor's order and what they're doing for physical therapy. Again, like I mentioned when I was showing you the knee apparatus, the 90 is marked differently than all the others because it's a very, very popular setting, is the only reason for the flexion. So for right now, we're going to go ahead and keep it locked in full extension, so I can demonstrate a couple other things. These 2 brackets are the brackets that are applied to the humerus, the upper arm. They are adjustable depending on the patient's length of arm, and as well, if you pull it out of the package and the upper part is rubbing on their armpit, you can of course bring it down. And more importantly, what I see a lot working in pediatrics, I'll show you real quick. When they are allowed to have flexion, and if for whatever reason they're locked in flexion, I have found with the smaller patients that when you come down to here, if this bracket, the distal humeral bracket, and the proximal radius ulna bracket, forearm bracket, I found that if they're at the very lowest hub, that they tend to rub right here in this crease right here. Like the way my shirt is folding right there, this will rub right in there, and it'll really irritate the patient. So if I'm working with a little one, I tend to bring this up a notch or 2, and that way it gives them a little bit more space in there. You'll see me do that maybe with the patient we're working with today, but it looks to me like this patient has longer arms. But both the forearm, the radius ulna, and the humerus one are both adjustable in the same way. Other thing you want to make a note of course, the straps are similar to the knee straps. This particular brace is really nice. It comes with removable Velcro adjustable medial pads for that soft medial under part of the arm. So this way the strap doesn't accidentally pinch them. It's really nice, and you can put it anywhere you want on the strap, depending on the patient. And it has it for both the inside of the forearm and the inside of the bicep in here. And the other thing that's really nice about this, of course, the 4 straps. Let me lock it again. The other thing that's really nice about this, say for example, it's like say it's like football season, and you get like somebody with like a really, really big arm. These are very adjustable. They're very malleable. And say you get like, I don't know, say you get like a cross-country kid or something, and they're really, really slender. You can really, really bring this in really nicely. But if you do it, make sure you do it like in a C shape. Don't just grab the ends and pinch them, because if you grab the ends and pinch them, you have a possibility of a crease in there. So whenever you're going to adjust it, you always want to adjust it so that it looks, and I'll come up close so you can see, but as you're looking at it from the top down, you want it to look like letter C's going down. So, and then this bracket, the very, very bottom one that's not down here near the wrist, it has a different appearance for 2 reasons, which we'll get into in a minute. And you'll notice too that of all the straps, 1, 2, 3, and 4, this one is different. It doesn't have the blue buckle, which we're going to talk about why in a few minutes. So just a moment, I'm going to go ahead and apply this to the patient, and give me 1 sec. Okay, so now we're going to go ahead and apply this to the patient. This is pretty easy. I'm going to go ahead and unlock it, and I'm going to go ahead and leave it 0 to 90. The patient is actually almost at 90 already, so it's going to be really, really easy to visualize this. So that being said, in case for whatever reason you get confused, the name of the brace is always at the top. I know that's silly. the name of the brace, and then the brand is always at the bottom. I'm not going to promote the brand because we're not getting financial reimbursement or anything. But you open up the brackets just a little, and you just lay it on the arm, just like so. You just lay it on the arm very comfortably. You check your measurements. Now remember how I mentioned a moment ago, go ahead and have them bring it all the way up and make sure that there's no rubbing here in the crease, which you can see. I think we're good. I think we've measured off right. And then you just kind of shape it to this person's particular bicep and forearm and wrist. Now in this case, I'm going to change my mind. I'm going to make it a little bit longer so we don't have too much wrist drop. There we go. So if you can see how the bracket's resting now we're going to talk about the straps. So you bring the strap over, and in this particular case, this brace has little channels, little tunnels where the strap will actually rest inside that little tunnel. And just like we did with the knee on part 1 of this 2-part series, you put it on, and if you have to, whatever reason, tighten it, you take the Velcro off, and you put your fingers here for opposing pressure, and you tighten it up. And you just make it nice and snug, and then you bring it around, and you Velcro it. And we'll do the same thing on number 2. I'll undo the Velcro first. And then, like we talked about a second ago, here's that little pad, that adjustable pad. So in her case, we need to bring it in a little bit. So we're going to bring it up just a little bit more so it fits right on the meaty part of her under the bicep there. We'll follow this little channel that's in the brace. We'll hook it on the little sharp tooth there. And then, same thing, we'll cinch it up and we'll Velcro it. Go. And then we'll go ahead and do, this is by the book, this one is number 3. Now I mentioned how these 3 had the buckles and this one only has the strap. So you bring the strap, you run it through this little loop right here, this little, right in there. And then this is easy, you just cinch it up like you would cinch it up like a belt, not too tight, just normal, and Velcro. Oh, you know what I want to show you real quick while I have you up close? Let me show you this. These little Velcro straps, if for whatever reason, say for example, you have a super skinny arm and you bring it around and you happen to hit a piece of plastic or something where it won't stick, you can remove these. You can remove these, and depending on your facility and your policies and depending on the doctor, you can either trim these so that once you put this back on, it'll have a place to stick, or if your facility is very adamant about not cutting these, you can fold it over, believe it or not. You can fold it over, or in this case fold it under, put the Velcro back on, and you can Velcro it like this, because some places their policy is not to cut the straps, so I respect that. And last one, I'll have her lift just a little. We'll get underneath the arm here, we'll come up underneath, right through the channel, we'll hook it, we'll do a little bit of pressure, and I'll bring it all the way back under, just like so. And as you can see, she now has the hinged elbow brace, and if for whatever reason the doctor's like, I don't want her moving it, I don't want her moving it, she just had surgery a couple days ago. You lock it, nothing. Unlock it, back to motion. And again, the settings like we talked about with the knee are completely up to the doctor's orders. So let's say, for example, this particular doctor, this particular patient, we're going to keep her at 90. This is what we want. Now, this particular brace comes with its own sling or strap that acts like a sling. And there's really just one thing that's interesting I want to show you, but I'm going to position this in just a way to where you can see what it does. Just right there. So pretty simple. One of the little hooks obviously goes right here. And this explains why this particular part of the brace is different than all the rest. So that goes right there. It's pretty self-explanatory, right? Now, you have a pad that goes, you don't have to move the camera. It goes around the patient's neck, of course, like we all know what a sling does, just like so. And I'm gonna go ahead and do this so you can just see. And then, this is the interesting part, watch this. Instead of it coming around the back and hooking into some other part of the brace, it literally comes around the front, in her case right above the midsection, and it hooks back to itself. And that is what it looks like. So again, thank you very much for watching part 2 of a 2-part series on hinged knee apparatus and hinged elbow apparatus. I hope this helps for those of you that were asking, and we'll see you at the next video. Thank you very much.